my name is Darlene, and I am going to be your student nurse today. Can I have your name and date of birth? Thank you, Miss Wilson. I will also match mom's ID band to baby's ID band to make sure that they are in the right place together. I'm going to wash my hands, provide privacy. Today, I'm going to be doing a postpartum assessment on you, as well as look at other parts of the body system. First, I am going to have you go in void so that way your bladder is empty when it comes time to do an examination of the fundus. So I'll give you time to go urinate. Okay, perfect. So I'm going to wash my hands again, and I'm going to apply all my gloves. Now I'm going to check your vital signs. First, I'm going to start with your blood pressure. Okay, your blood pressure is 120 over 60, which is good. A normal finding is anything 120 or lower over 80 or lower. Now I'm going to check your temperature. Okay, your temperature is a 97.6, which is a normal finding. Temperatures can be between 97 to 99. Now I'm going to check your pulse. Your pulse is at 76, which is good. Normal finding is between 60 and 100. And lastly, your respirations. And your respirations are 16. Normal findings are between 12 and 20. So, now that your vital signs are done, first I'm going to ask, are you in any pain? You have a pain level of an 8. Okay, so what we'll do is we'll try to reposition you to get you a little more comfortable. And I'll also go over some relaxation techniques with you, such as meditation. And then I can also implement massage. I'll go and check and see if you are able to have your as needed medications to see if we can get you a little more comfortable, okay? Okay. So now that that is taken care of, I am going to assess your heart sounds and your lung sounds. So we are going to listen at the apical pulse. Okay. Your apical pulse is normal. The rate is even and regular. And now I am going to listen to your breath sounds. If the apical pulse were abnormal, then I will listen to it for 60 seconds. Okay, I'm just going to say you so I can listen to the back. Okay. Lungs are clear to auscultation in all lung fields, which is a normal finding and also what we want to see. Lastly, I am going to listen to your bowel sounds. First, when was your last bowel movement? Today. Okay. Bowel cells are present in all 4 quadrants. Any tenderness? Okay, perfect. No tenderness. Okay, so now I am going to assess the level of sedation. Okay, so you are answering questions appropriately. My patient does not seem to have a loss of consciousness. My patient is ANO times 4. My patient is not confused. I was able to see her ambulate when she got up to go to the bathroom. Her gait is steady. My patient's respiratory rate was a 16, and the rhythm or effort is regular and it is also even, which is a normal finding. My patient has an IV in her left forearm. She has normal saline running at 100 milliliters per hour. The IV site is clean, dry, and intact. There's no infection, infiltration, or phlebitis present. Okay. My patient does not have an indwelling catheter, but if she did, I would check the patency of it to make sure that it is flowing smoothly and there is no backflow because that could cause an infection. I will make sure that it is below the bed and that it is hanging below the bladder. Miss Wilson, have you experienced any nausea or vomiting? No. Okay, perfect. And the last thing I am going to do is the input. Can you tell me roughly how many milliliters you're urinating when you go to the bathroom? Roughly about 200. Okay, that's really really perfect. It's typical for a mom to um, eliminate 250 to 500 milliliters during urination. So that's really really good numbers. You said 250. Okay. And so now I am going to do an assessment of the breast. Can you tell me if you're breastfeeding or if your baby takes the bottle? You're breastfeeding. Okay. So do I have permission to touch? Yes. So I'm going to feel the breast and also access the nipples. So the breasts are soft, the nipples are erect and intact. I wanted to make sure that the nipples did not have any redness or any cracks, and also that the breasts were not firm or engorged. It's typical for breasts to be engorged if mom is not breastfeeding, and you can use a warm compress to kind of to help with the engorgement. Um, Also, some of the benefits of breastfeeding are that your body naturally releases oxytocin, which is good because that helps the uterus contract to prevent postpartum hemorrhage. Another benefit is that breast milk has all of the essential nutrients that the baby needs, and studies have shown that it's better for the baby to obtain its milk from mom versus a formula. And then it also gives you that one-on-one bonding time with the baby, and it also helps your body as it just went through a major change because of pregnancy. So it kind of helps with getting your body back to its norm. One thing that you will want to teach is if I'm sorry, one thing that you will want to report to your doctor is if you notice that your nipples are red and swollen. Also, if they're warm, because that can indicate some type of duct clog or infection. Okay. Um, Now I am going to assess the uterus. This is why I had you empty your bladder to make sure that I can find the fundus in the correct spot. So I'm going to use my hand to stabilize it, because if you don't use one hand to stabilize it, you can actually um, flip the bladder, and you don't want to do that. Okay. So the fundus is firm, which is a normal finding. If it was soft, we would want to massage it. Um, the fundus being soft could lead to a postpartum hemorrhage, and that is something that we don't want. The fundus is midline, and it is 1 finger breadth below the umbilicus, which is a normal finding, and that is also what we want to see. Um, you can expect your uterus to return to pre-pregnancy size in roughly 6 weeks. Um, that's just a general estimate of when you can expect it to return back to its normal size. And now we are going to talk about your bowel sounds. So I already assessed your bowel sounds. They were present in all 4 quadrants. Some ways that you can prevent constipation. Constipation is very common for moms after they give birth. So it's important to get up and ambulate early. Making sure that you drink your fluids. You want to make sure you get enough fluids in. And then also eating fiber, because fiber helps move things along in the digestive system. Okay. Something else that we're going to talk about are ways I'm going to assess the bladder. So One up low. There is no evidence of bladder distension, which is what we looking for. We don't want that because if the bladder is distended, that could lead to a postpartum hemorrhage because your uterus is not going to be able to contract as it needs to. Um, so some signs and symptoms of a UTI. One of the big ones is burning upon urination. So this is why it's very important that you want to make sure that you wipe from front to back. Okay. So moving on along, now I'm going to assess the lochia. So your lochia, you have a moderate amount, which is fine. When was the last time you changed it? Okay, so about 3 hours ago. Okay, that's good. And you only have a moderate amount. So within the first 3 days, it's normal to expect a rubia color, which is the red that you see. That's normal. And then in 4 to 10 days, you'll see a serosa color, which is like pink tinge. And then after that, you will see an elba color, which is white. And those are all normal colors. You will want to report if your um, your lochia went from the rubia directly to the elba, because that wouldn't be a normal finding. Also, if you see really large clots, it's normal to have some, but they're about dime size. If they're really large, that's something that you would want to report. And also if you are saturating a pad within an hour, because those can be symptoms of a postpartum hemorrhage. Some of those are symptoms of a postpartum hemorrhage, and that is something that you don't want. So someone who has a baby via C-section, which is you, it is normal to lose about 1,000 milliliters of blood. And someone who has a vaginal birth, is normal for them to lose about 500 milliliters of blood. You can expect your menses to return in 6 to 8 weeks. Um, if you're not breastfeeding, but if you are breastfeeding, then it can be a little longer. It kind of varies person to person. So that's just a rough estimate for you. Now I am going to take a look at your incision from your cesarean section. Okay, so your incision is not red. There's no evidence of edema, no ecchymosis. There's no drainage, and it is well approximated, which is a normal finding. That's what we want to see. If you had a vaginal birth, then I would have checked for lacerations and also rate the degree of it. As far as pericare is very important. You want to make sure that you're cleaning yourself very well, especially that perineum area. You want to make sure that you are wiping from front to back. This is to avoid any type of infection. If you notice that perineum area is getting really sore or swollen, you can use an ice pack, and then you can also do a sitz bath. But it's very important to keep that area clean to prevent any type of infection. Some signs that you will want to report to your healthcare provider is if you notice that incision was red, if you notice that it was swollen, or if it was no longer well approximated, which means that it's no longer intact and closed together. Because that can risk infection, and redness and swelling could be a sign of infection. So you will want to report that to your healthcare provider. Now I am going to assess your strength. Okay. So can you squeeze my fingers? Squeeze my finger. Push my hand down. Pull it back up. Perfect. Push my hand down. Pull it back up. Okay. Now we're going to do it with your legs. Okay. Can you push my hand down? Pull it back up. Push my hand down. Pull it back up. Okay. I'm going to check pedal pulses while I'm down here. Pedal pulses are +2 equal bilaterally, which is a normal finding. And now your radial pulses. Radial pulses are +2 equal bilaterally. Okay. So now I am going to just. Oh, I see that you have the SED device at the end of the bed. Have you been putting them on your legs? Yes. Okay, perfect. This is a way to prevent deep vein thrombosis, which will indicate that you have a clot, and that is something that we do not want. So you want to make sure that you are using those devices, okay? It's very important that you have them on your leg. Um, Forgot to check for edema. All right. My patient has no edema in the lower extremities, or there's no edema in the upper extremities, which is a good finding, and that's what we want to see. It's very important that you get up and ambulate because that helps just get everything moving and flowing. It'll help prevent constipation. It decreases the risk of you getting a blood clot. And then also when you're just laying in bed, you kind of lose muscle tone. So it's good to get up and you want to ambulate. Okay. You want to avoid crossing your legs. Okay, because you just had your baby. And then also you will want to report if you have any signs of a um, deep vein thrombosis, which is going to be a blood clot. So if you feel any warmth or if you notice that one of your legs is larger in a particular area, if you notice in one spot, you do not want to massage it because that can lodge the clot. Okay. And then the last couple of the last things I want to talk about is how are you feeling emotionally? How are you adapting with being a new mom? You love it and everything is amazing. Okay. And do you feel like you have a good attachment to your baby? Yes. Do you feel down or sad? No. Okay. And then how do you feel your bonding is with your baby? Bonding is good. You like skin to skin. Skin to skin is very, very important for the baby. One thing that I had learned is that when the baby is skin to skin with mom, if the baby's body temperature is cold, mom's chest automatically will warm up, and vice versa. If baby's body temperature is too hot, mom's chest will cool down so that the temperature is appropriate for the baby. And then it also kind of helps, skin to skin also helps regulate the baby's heart rate. Okay. And then who is your support system? Husband, mom, sisters? Okay, perfect. So it sounds like you have a good support system. I'll also give you some resources that you can reach out to should you feel the need. And also, if there's just anything that you need help with or further information because you are a new mom, I can give you resources and support groups that you can also use for comfort. Okay. And how do you feel about parenting skills? You're a little nervous, but okay, but you feel like you kind of have everything together. Oh, so this is your husband's second child. Awesome. Okay. And the last thing I am going to talk about is one method of contraception. So I'll talk about condoms. Mm, so with condoms, you want to make sure that it is the proper size. They're both male and female condoms. You never want to use them both together, but condoms can prevent the chances of you getting any STIs or also any unwanted pregnancies. Condoms are not 100% effective, but it definitely reduces your risk of getting those, getting some type of STI or an unwanted pregnancy. Is there anything else that I can do for you? Okay, I'll be back in to check in with you shortly, okay? It's been a pleasure speaking with you. Okay, bye-bye.